5 years ago, health officials first recommended the HPV vaccine be given to girls and young women to protect against the human papillomavirus, a sexually transmitted disease that's a major cause of cervical cancer. It's been available to boys for the past 2 years to guard against other medical problems associated with sexual activity. But today, for the first time, a federal advisory panel said that boys age 11 or 12 should routinely get the vaccine. We get an explanation and update from Rob Stein, health and science reporter for The Washington Post. Welcome back.
Hi, nice to be here.
Now, why is the committee saying it's time to turn from a suggestion into a recommendation?
Yeah, well, the vaccine was approved in 2009 for boys, and at that point they didn't recommend that it become part of the routine vaccinations that all boys get as part of the going in for their well baby visits or their childhood visits. But in the last few years, there's been enough data has accumulated where the committee now feels like it makes sense to recommend that, like girls, all boys that are 11 and 12 routinely get the vaccine.
And remind us of a little bit more about what HPV is and the risks associated.
Yeah, HPV, it's the human papillomavirus, and it's a sexually transmitted virus. It's actually the most common sexually transmitted infection. And it can increase the risk for all sorts of things. It can cause genital warts, as you mentioned, in girls and women, it can cause cervical cancer, and in boys and men, it can cause anal cancer, penile cancer, throat and mouth cancer. Actually, it's become one of the leading causes, if not the leading cause of throat cancer.
Now, the vaccine, as we said, was recommended for girls 11 and 12. It's been controversial from the start.
Yeah, this is one of those health issues that's been kind of bogged down and got kind of sucked into the politics and economics of some of the issues that it raises. Early on, there was a concern among some parents that just giving a child a vaccine for a sexually transmitted virus might somehow send a signal to the children that it's okay to become sexually active.
And so that's, of course, played into some of the recent presidential
Yes,
politics.
That's right. Well, yeah, in Texas, when Rick Perry was governor, this was a big issue, and he tried to make the vaccine mandatory, and that got a lot of people upset, and they ended up having to reverse it. And then Michelle Bachmann weighed in and made some comments about some of the supposed health risks from the vaccine, and it got all caught up in the GOP presidential nomination process.
Scientists clearly stand by the health associated with it.
Yeah, the vaccine is extremely effective, and so it's been administered to more than 40 million girls so far in the United States, and so far it appears to be very safe.
Now, my understanding, however, is that a very low, unexpectedly low, I think, percentage of girls have gotten the vaccine.
Yeah, it's been actually a big disappointment to public health advocates because this was seen as a major breakthrough for preventing cervical cancer. And so far, it's only been about 40% of girls who are eligible have gotten at least one dose, and only about 30% have gotten all 3 doses of the vaccine that they need.
And is that thought to be because of the talk surrounding it?
Yeah, the thinking is that it's because of all the controversy that's swirled around the vaccine. It's a combination of factors. Part of it is parents being sort of worried about giving it to children, when they're so young and not even thinking about becoming sexually active. And also, there's been some concerns that it's a new vaccine. A lot of parents just think, well, I'm not sure. I'm going to wait a little while and make sure this thing is safe.
So is it right that part of the thinking now in recommending it for boys is not only to help boys, but also to prevent cervical cancer for girls through the later possible sexual activity?
Yeah, it's really, the thinking is sort of two-pronged. One is to protect the boys from all the cancers and the genital warts that the virus can cause, but it's also to reduce the spread of the virus when they get older and have sexual partners, and that's both for women and for other men.
And is there reason to think that these new recommendations will be equally controversial?
It'll be interesting to see how it plays out. It doesn't seem to be creating the same sort of concerns about sexual activity that the recommendation for girls did, but there still are a lot of people who are not so sure about how safe the vaccine is. And so it'll be interesting to see what the uptake is. So far, only about 1% of boys who are eligible have gotten the vaccine. It's been available since 2009.
What about other factors like cost, like insurance coverage?
It's a very expensive vaccine. It takes 3 doses, and when all is said and done, it costs at least $400 just for the vaccine itself. And then, that doesn't count all the doctor's office visit costs. And so that's, again, one of the reasons why this recommendation is so important, because it could lead to more insurance companies covering the costs.
So what happens next? What's the next part of the process?
This is a recommendation, so it still has to become a final set of guidelines, and that'll come out of the Centers for Disease Control and Prevention. But they usually follow the recommendations of this committee. It's a very influential committee that they rely on to set their guidelines.
What kind of time frame are we talking about
It's probably
before this would become a...
Yeah, they haven't set a specific deadline, but it's probably going to be pretty quick. They don't usually spend a lot of time waiting on something like this.
All right. Rob Stein of the Washington Post, thanks very much.
Nice to be here.